Hey guys, Dan Michelli here. I'm going to talk to you guys about MS today. MS is what we call multiple sclerosis. Did you know that over 400 people in the United States have been diagnosed with MS and over 2.5 million people have been diagnosed in the world with MS? With the number of diagnoses every day, it is good to know what we're up against. I have done a pretty good amount of research on the effects, symptoms, and treatments for MS. My wife was diagnosed with MS about 4 years ago, right after my daughter was born, and she continues to struggle with it day in and day out. Multiple sclerosis differs from many diseases due to its effects and symptoms and the way it is treated. What is MS, we ask? Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. What that it is it's the immune system attacks the protective sheath that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause the nerves themselves to deteriorate or become potentially damaged. Most people with MS have relapsing, remitting disease course. They experience periods of new symptoms or relapses that develop over days or weeks and usually improve partially or completely. About 60 to 70% of people relapsing, remitting MS eventually develop a steady progression of symptoms with or without a period of remission, and this is known as secondary progressive MS. Then there's also primary progressive MS, which is some people who with MS experience a gradual onset and steady progression of signs and symptoms without any relapses. What are the symptoms and complications of MS? Well, multiple sclerosis signs and symptoms may differ greatly from person to person and over the course of the disease depending on the location of affected nerve fibers. The symptoms and complications may include a list of things that you might think is something common. A list of them might be numbness or weakness in one or more limbs, typically on one side, partial or complete loss of vision, usually in one eye at a time, prolonged double vision, tingling or pain in parts of the body, electric shock sensations that occur with certain neck movements, especially when moving neck forward, tremors, lack of concentration, slurred speech, fatigue, dizziness, problems with bladder, bowel, or sexual functions, muscle stiffness or spasms, paralysis, typically in the legs, mental changes such as forgetfulness, mood swings, depression, even epilepsy. The causes of multiple sclerosis are unknown. However, there have been risk factors which may increase the risk of developing MS. Some of those factors include, most commonly, it affects people between the ages of 15 and 60. Women are twice as likely as men to develop MS. If one or more of your siblings have developed MS, then you're at a higher risk as well. Another strange one. White people, particularly of Northern European descent, are at higher risk, as well as smokers over non-smokers. What is the diagnosis? A complete neurological exam and medical history are needed to diagnose MS. Some tests that they use to diagnose MS are spinal tap, MRI scans, blood tests, also evoke potential tests. There is no cure for multiple sclerosis. There's only the hope to slow down the progression of this disease. Doctors use multiple drugs and therapies in order to slow progression of MS. Some of these drugs are beta interferons, Tecfidera, Gilenya, Aubagio, and Lemtrada. Some of the therapies include physical therapy, muscle relaxants, and medications to reduce fatigue. MS is still unknown territory for the medical field, and all that we can do is live healthier lives and hope to never have to experience this nasty disease. If we do encounter MS, there are many types of drugs and therapies to help us live normal lives with few relapses. I hope that every one of you have taken something from this and hopefully never have to deal with this, but if you do, I hope for the least I gave you the knowledge to fight back against MS.